What's the most attractive, I think, to the owners group, which is the Five Hills Health Region and the Saskatchewan Ministry of Health, is that we wanted to maximize value to our patients and to the healthcare providers that work in this facility.
We worked with Five Hills. We looked through this procurement approach. We did the research. We looked really strongly at what some of our colleagues in different countries, notably the United States, they've done a lot of this work. I looked at some of their best practices in terms of we thought it would work well with us. Ultimately, we decided to move forward. It was definitely a learning experience for all the partners, but we felt that we had a strong relationship. We had a strong team.
The new method definitely was interesting, and we a lot of times try to operate our other projects based on partnerships and collaboration and that kind of thing, and just the way this whole IPD process was put together, it really made sense for us. It was tied into our values and morals across the company really well.
We were extremely excited about the opportunity to be involved in something new that had potential benefits for the community.
Certainly as an industry, we have lots of room for improvement. Our industry is known for having lots of rework or redesign, for extensive delays, extensive cost overruns.
We're always looking for cost certainty, timeliness, transfer of risk. So all of those things, I think they worked well with the IPD approach.
We knew that there would be greater involvement within the organization in terms of the design, building on time and on budget.
And we have a culture of continuous improvement already in our organization, and this one really reinforced that.
We intentionally set out to actually work in a different way, and we set out to find a better way than the traditional models. And to our knowledge, this is the first major integrated project delivery, not only in Saskatchewan but also in Canada.
Well, I would compare traditional construction and IPD as would be more compliant on the traditional versus collaborative on the IPD process. What I mean by that is that in a traditional process, your design is complete, the drawings are put out for bid, a contractor is selected, and work starts in the field. There's really no collaboration or decision making with regard to design, and if it's over budget, then all of a sudden the owner is put in a really tough position, whether they have to cut scope or they have to write a change order. With an IPD process, you actually end up getting involved right at the very beginning of the process. So the design team, the construction team, and the ownership are working together collaboratively to come up with the best solution, which gives you a great design at a reasonable cost, and speed to market is far better than a traditional model.
So one of the benefits of this integrated lean project delivery method is we go to market for a team of architects and builders that come to us and say, we understand what it is that you want to build in the way of a building, and we propose that we can do this project as a partner with you.
And of course it shortens the timeline, but the most important value is that the builders or the contractors become part early on of the design process, which really helps with innovation, fast-tracking the schedule, and also can help significantly with managing the cost.
And when we have the builders involved in design, they can advise the engineers and the architects about, hey, wait a minute, because I'm going to build this thing, if you do it this way, I can push the construction cost down, because this is a far better method for me to build it.
The staff, the patient family reps, the rest of our team were very involved in defining what we felt was important to the design of the hospital. So that was very different from anything I'd been involved in before.
We work on a lot of construction management work where we're brought on early in the process and working with designers and owners, but never to the extent that you do an IPD, where we met full-time for 3 days every 2 weeks with a group of 40 to 50 people in the big room. You're all there, you're together, you're co-located, and you're essentially building the design together as a group.
Because it was a different way to deliver the project, one of the things that we required was to also develop a new form of contract. Typically, the system is designed that each of the parties is trying to offload risk, and obviously there's a cost to risk. So whoever has to cover their bases to handle any potential risk has to ensure that's included in their proposals, which means ultimately whoever the owners are end up paying more for it. Because in integrated project delivery, one of the fundamental differences is that risk and rewards are shared between all the key participants. We had to set out to develop a form of contract that was different than the typical model, which some legal experts refer to the traditional way as being more confrontational in nature or adversarial. What we did is we set out to work more collaboratively with our partners, and therefore we developed a contract known as the integrated form of agreement. We, of course, had to bring in, this was, to our understanding, the first Canadian version of this type of document. So we needed to rely on our legal experts to help us put together the framework and the format for that document. And so we've developed that, and we've actually, to date, agreed to share that somewhat publicly.
It's a method of incentivizing people, but incentivizing them on the same outcome. So as long as the participants are all aligned in that outcome, then you'll have a positive experience. That's hard to do because it's hard to, in one-off situations, make sure that all your teammates are aligned.
With it being a new process, new to not only the province and the city of Moose Jaw, but new to the country really, nobody was really used to putting their profit at risk. And again, when you look at it on any project for any company, their profit is always at risk based on how they perform, but it's based on how they perform, not how the team performs. So there was a level of uncomfort for people getting into the process to put their profit at risk that they didn't fully control. Going into the next project, I think part of the onboarding process needs to be a little bit more knowledge and more learning about what the risk pool is and how it works and that kind of thing.
It was very challenging to arrive at the early budgeting in a really inflationary market and with different team participants that had more or less experience in ILPD. And not just the team participants, but the marketplace participants.
There's actually quite a bit of work in the area, and so the willingness of trade partners to get involved in this type of delivery was a little bit slow because they weren't sure. It's something new, something different. They kind of take the position of, I'm very comfortable doing it the old traditional way, so why would I want to get involved in this because I'm just not sure how it's going to turn out. I think we did a pretty good job of overcoming that through various meetings that we had and pre-bid type of discussions, and I think we got a lot of really great trade partners on the team.
Everybody has their profit or the risk incentive pool identified, but at the same time you almost put that aside. You put that aside and you're not necessarily worried about that, then you're worried just about the cost. You can take the cost and it's in everybody's best interest then. So if somebody comes up with a really innovative idea to drive the cost down, that not only benefits them, but it benefits the rest of the team. And then what we found a little bit was that's sometimes contagious, is somebody comes up with a great idea and starts driving the cost down, and then it almost becomes like a little bit of a friendly competition, and it was great to see some of those innovative ideas.
Probably the most important aspect of self-forming is ensuring that all of the ILPD team members are aligned in their thinking. So team makeup on any project is important, and people have to want to work together and have the ability to work together. There's no difference with an ILPD except that you're bound more tightly together, and so that trust is tested more often, and that the comfort needs to be there because you're working in such close proximity with one another.
We had an onboarding process. I think the level of detail of that onboarding process and sticking to it all the way throughout the duration of the project is a definite lesson for that we took out of it, and I think the remainder of the team would agree. When you're bringing these people on, there's so many differences between this process and a traditional method that they need to be made aware of that. They need to be made aware of what different commitments are required of them, and what their time commitments are, and how they have to act even.
A team needs to take care in picking their partners, just as you would take care in picking a partners for in your own organization. You have to extend that rigor.
You want to be able to ensure that they can integrate well into the team, and those people are going to be able to provide value. I think that's much more important, and that they've got the right attitude and the right, sometimes even personalities that are going to be able to integrate into the team. And sometimes that is even more important than price, and having the right attitude about even things like prefabrication and collaboration and value, and trying to bring those things to the table. The ability to drive the cost down is more important to the team than an extra % on profit potentially. And every situation's different, but that would be one thing that I would notice.
One of the problems we faced during the procurement and construction of the project was a turnover of key team members. So unlike the traditional approach, where you could easily bring a new partner in that understands that procurement approach, bringing in a new partner midway through or towards the end of a project proved difficult for the IPD approach, just because there wasn't that expertise out there we could tap into. My advice to any other organizations considering the IPD approach for procurement would be, if you are bringing on new partners, or there are personnel changes throughout the project, that those people receive adequate training on the procurement model.
The union leaders or the business agents, I think it'd be really important to reach out to those people at the very beginning of the project. Tell them that this is a unique and a new delivery method that's going to really have to center around productivity and efficiency. Just by trying to deal directly with the tradesmen on the job site was difficult. They didn't understand what we were trying to do. They really felt threatened by some of the things we were trying to ask them to do. And I think if we would have had those discussions up front with their business agents, that we could have mitigated a lot of that concern.
There was some restrictions imposed upon the team to not have trade partners involved in the process, no commitments made to them until after the validation report was signed off. And that validation report, before that was signed off, there really wasn't a project, so we understood what the restriction on that was. But I think moving forward, the price that we'll pay to have those people involved in providing input into the process is a very small price to pay when you're comparing against the gain that you'll get out of the backside.
Although we had experience on the team, there was some differences that were difficult going across the border, in differences between the marketplaces in the U.S. and Canada, and what their experiences are, and in putting things in the context of a Canadian delivered project.
I wasn't really sure quite what to expect. What I can tell you, though, is that whether it's in the U.S. or in Canada, the biggest challenge is just finding people that are experienced in working in a collaborative environment. That's the biggest challenge.
It was critical for us to ensure that we had good coaches to help us understand this new way of working, and therefore we relied early on having that guidance from coaches who had proven experience using integrated project delivery, and not only in the construction field, but in our case also in architecture or healthcare architecture.
So design workflow and construction workflow are quite different. So it's important for the team to talk about those differences, and in the areas where we did have lots of dialogue, we had good results, because it teased out problem areas early on. It takes a lot of rigor in the communication process to ferret out where all those touch points are, and taking out the kind of shorthand speak between designers and constructors and people speaking completely and fully as to what their expectations are.
The big room was an absolute staple in the process, and it is a major staple in IPD, and really the big room is just a place where everybody can come together and co-locate and work together towards putting all this work together for the project.
Those weeks were really valuable in our involvement in those conversations, because all of those people are in the same room, and when the structural engineer says, well, I need to put a pillar right here, there's not a whole lot of, they need that architect there to say, what's the implications of putting this pillar here? And that architect is in the same room, so they can answer the question sort of right in the moment. And there's not me sending an email to the architect and waiting for him to respond for a week, and then me saying, oh, well, like it's a drawn-out conversation, where in the big room it can be a sort of a more immediate conversation where I can just say, hey, wait a minute.
In traditional design, you're thinking about designing the mechanical systems or the structural systems or architectural systems, but in the ILPD process that we used and reinforced by the use of the big room, we broke down into cluster groups that focused on certain elements like the exterior team. And that exterior team would not just have architects and structural engineers involved, but we would have our energy modelers involved, mechanical engineers involved, so that we could take into consideration different disciplines and how we might optimize a system, taking from the notion in lean of optimizing the whole and trying to put that into practice. So that was something that we had not experienced before, and it was in general, it was a very positive experience.
When you look at multiple solutions, it seems to take perhaps a little bit longer on the design side, so they might actually spend a little bit more. But when you look at it from a construction solution, you can save money on that side because you come up with a better, more efficient way to do it. So overall for the owner, it ends up being a more cost-effective way to do it.
So one of the aspects of the project that we didn't anticipate was just the extent to which the involvement and the commitment of senior people and the time commitment that was required by participation in the big room. So although it's of great benefit, it's something that is much more significant than in a typical project delivery. Your senior team members do have to spend extensive time in the big room, and bringing their expertise to the project is a huge time commitment.
Again, I'll talk about trade partner onboarding and involvement, where I think some of these trade partners came in and they were maybe even a little overwhelmed by the big room and by the process, where a lot of others between Five Hills, Graham, Bolt, Stantec, some of our other partners, Devaney Group and others, Black & McDonald, we were involved in the big room, and we were at the big room for months and months and months. So it was just second nature to us, and it was a little bit daunting for some of those people to come in. And
so co-location for the design team was quite beneficial. However, one of the things that we found through it was that the engineers are actually it's more difficult to have the engineers co-locate than the architects. In some later work, what we decided to do was to, instead of co-locating to a totally unique location, was to set our architects in amongst our engineers in their traditional space. That gave us the ability for the engineers to work with their colleagues that weren't on the project in obtaining technical information to try to speed the process up. So availability to technical resources for engineers are quite important. And so the co-location, the actual location of the co-location is important.
It's a big open area where everybody can be open and collaborative, and you don't want any walls up or anything like that, because everybody wants to be able to hear all these conversations so they can have input at different points in the process. And that's the way we sort of started. And what we found is that although that's great, there is a definite need for breakout space. We found that very, very early. Although the collaboration is great, when there's that many conversations and that many meetings going on at the same time, and some are a different level of meeting, whether we have a core group meeting or an executive team meeting. Some of those discussions sometimes, although they're still collaborative within that group, sometimes they need to be closed door. And
there was some instances where problems would arise, or there would be instances where there was a challenge to overcome, and there was a tendency just amongst the partners to resort back to traditional approaches, the design to build approach, for example, where we are used to working in a certain siloed manner, where groups would prefer to go and solve a problem on their own. Through use of the big room, we were able to bring each other back to the collaborative approach and resolve those issues together.
I think that designers would be positively surprised by working in the team environment, particularly with the constructors, because many designers that have worked in that environment might think that the constructors were more adversarial, because that's been the nature of most construction, a kind of adversarial relationship between the designers and constructors. The ILPD team for it to be effective, then they need to be working constructively together.
The fundamental improvement that we made, I believe, in the design is we included patient and family reps on integrated teams made up of patient and family reps, different healthcare provider, physicians, and basically brought the teams together to work on designing different components or parts of the hospital.
And we actually get their ideas about what they think a patient room needs to be laid out like. And then in part of that process, we actually model it up in different scales. In fact, in the end, in a full scale patient room was mocked up out of inexpensive materials like styrofoam and 2x4s, so that we could actually walk into those spaces and appreciate the size of them and pull beds and do mock exercises within those spaces to make sure that they were big enough. And that's much more easy for people to relate to those models than it is a drawing on a piece of paper, because you don't really understand how much difference there is between the bed and the wall, or the chair and the bed. But when you build a model, you can actually put a chair and a bed in there, and then you can understand the space far better. So
it's a pretty important process. And we went through 3 of those. By the 3rd one, we were saying, can we do the first one over again? Because you learn every time you go through one.
It was really very good. I felt that if I had suggestions, that I was listened to. I felt that if I was supporting someone else's position, that became important. But probably the best part of that was the education. Like, I think you can't go into something brand new like this unless you know what the guidelines and parameters are, and it was really well explained, and time was taken, and if we had questions and had to take extra time, that was done. It was for the group that I was with, it was just an exceptional experience.
There was a whole room full of people, and I thought they were all going to be like me. And they asked everybody to introduce themselves, and they started with CEOs, and they started with board chairs and supervisors and managers, vice presidents, and I'm thinking, what am I doing here? And my plan was to spend the morning and see what they had planned for lunch, because I was scheduled to be there for a week. And my first morning was not good. So I figured, I know who the caterer is, lunch is going to be great, then I'm gone. And lunch was great, and people started talking to me. People I thought, why are you talking to me? But they kept asking me, they didn't stop, which totally amazed me. And by the end of the day, I was sold on the whole idea of being there for the 3P. And as the week went on, I became more and more convinced that this was the route to follow. That their plan was one of the greatest things I've heard in many years.
For me, I think there are 2 things. I'm a teacher. So when when you think of doing things in groups, I think the structure of the groups is so important.
The consultant that was helping us with that was pretty adamant that we had to not involve the architects, that we really wanted to do this work ourselves. So after the first one was over, one of the things that we learned out of that was it's pretty tough work. And there's a lot of sort of background information that the architects can provide to help us get over some simple hurdles about design. How big is a standard room? How wide is a standard corridor? And without them there to kind of coach us along, not lead us, but help us get over hurdles as we talk about design, we could have used their help. And so as we moved on, we used their involvement much more so, and it was invaluable to have them there to help us with some of the modeling stuff, and again, some of those basic design concepts.
You have staff and patients and the team working on the design with input from the architects, but not being informed by the architects, is you don't have the same understanding in terms of what the limitations are, both from a standard perspective, but structurally. So in the end, there were some situations where the design didn't necessarily completely fulfill what the team was thinking it would. And so those are some of the pains that we still kind of have to work through.
What we have to keep reminding ourselves of, and the staff that worked in them, is that what they've done is come up with an intent to design. And yes, it's going to be the basis of your design is going to be respected in the final work, but really we have to meet the fire code, and we have to meet public safety needs and accessibility codes.
Have to have some way of making certain that the group is not homogeneous, but that they can work together to come to a consensus, or else you have to have group leaders who make certain that the people who have things to offer are heard.
They are so much work for staff. They get so emotional, caught up in it, because there is a lot of give and take about things that they really think that need to be involved. But then when we sort of pull ourselves back to what's patient first, what's really the right thing, and this is really the only space we have to work with, they've got to make some hard decisions about, well, it's really most important to have the right space in the patient room, right? And maybe we have to give up a little space out in what would be nice in the corridor or in the dirty service rooms or whatever. There's compromises all the time. So at the end of the event, when we brought other staff members who weren't involved in the P3, they came and looked at it and said, "Oh my God, what were you thinking? Like, what about the staff room? It's not nearly big enough. It needs to be, have a window, and it needs to be, all these other kind of things." So that was really tough for the staff that were involved to communicate with the staff that weren't involved and get them on the same page with where the design work had gone and why it was that they made the decisions that were made. And so that was a really big part of the learning that we probably could have done a better job of had we known, and we got better as we went through each cycle, a higher level of involvement.
Now, I don't think that you don't want homogeneous groups. You don't want the same people always making the decisions. But I think that people who are going to be involved always have to have that basic information. And so I think that in choosing people, even if it is a little more expensive, you have to have some information for people that are going to be involved in the work. People were committed, not committed, anti, but by the end of that week, it was just a really good experience, and mostly because there were resources for the people who were involved.
Pull planning was definitely one of the tools that we used all the way throughout the project, right through the design, through the construction, and it really allowed us to push off the major decisions to the last responsible moment. That's what pull planning allows you to do, is allows you to set that milestone and not make those decisions early that may result in rework. It allows you to push those decisions off and push that design off until the last responsible moment. But with that, you need to ensure that there's very rigorous pull planning and making sure that you've got all of those pieces, because when you're waiting to the last responsible moment, if that plan is not developed to the way it needs to be put together, if there's a hiccup in that plan and you're waiting to the last responsible moment, then you're pushing out that milestone.
Pull planning differentiates itself from traditional planning in that it works from the end goal backwards. And you are trying to pull information to problems as opposed to push information from people to other people. Just in the way that just-in-time manufacturing pulls parts when they're required for being put together, we pull information when we need it, as we need it. So in setting up the planning process, what you're trying to do is break up your planning into incremental pieces and develop the interrelationships with other pieces of information, and then be in a position to pull that information as and when you need it. An example might be being able to pull the window characteristics as and when you need it in order to do the cooling load calculations for the building, as opposed to the architect pushing the window characteristics to the mechanical engineer when he wants to.
We did really well on that at certain times and maybe not so well at other times. You need to make sure that you have everybody involved in these pull planning sessions, even though they may only have a small piece in the work plan. You need to be able to make sure that they're in that session to be able to make sure they have that correct input, and you need to be able to have people that really know what that work plan is and what that work will entail when you're putting together that plan.
Many of the team members struggle with the notion of the last responsible moment, and it's not really something that's particularly easy to pick. You're trying to actually delay your decisions until it is really the last time you offer the chance to change. Picking that time, though, is a challenge because there's so many moving parts and pieces, and oftentimes the last responsible moment isn't visible for people, and you have to make some assumptions. And that was a new way of thinking for a lot of people on the team.
I think the big thing is that when we create the pull plan, we're all standing there right in the front of the pull plan, and somebody says to me, Jim, can you have this answer by July 15th? What kind of a CT scanner are we going to put in that building? Because the mechanical guys need to know, the electrical guys need to know, and the structural guys need to know. Can you meet that date by this? And I'm standing in front of a whole group of my peers and I'm saying, yeah, I can meet that. It's pretty easy to say, yeah, I'll get it done by Thursday when I'm sitting in my office. And Thursday comes and goes and it's just not done. And then, somebody phones me and says, did you get that done? And no, this is very conventional, and it just drags out that design process and it takes longer to get it done. It's so complicated with so many players involved. But when you're all in the space together and you're holding each other accountable for meeting your targets, it's pretty hard to miss them.
It was completely new to the design team, and it was a big challenge to get people thinking about how pull planning actually worked, and it required a lot of letting go of the traditional scheduling and planning thought process. It was very difficult to start, and I would have to say that even at the end we were still learning because it was changing habits. Habits for some people that have been doing this for more than 30 years. You're trying to think of a new way of approaching something as simple as that we might say as simple as planning, but it was a new approach, and the team was committed to it. It had a lot of challenges around having equal participation and equal understanding, and I don't think that we ever actually got there. It's one of those things that I think you're going to have to repeat the process several times before people are going to develop the full competencies in the process. It's not about extending out the length of time that you need to process, but it's just moving it in the work sequence, and it allows you to reorder your work into a more efficient process line. That's in that way. We actually speed things up by putting them in the right order, even though it sounds like we're delaying decisions.
Well, regarding safety on an IPD project, I think it actually can enhance safety because you're talking about how things are going to be done at a very early phase of even in the design phase. We centered a lot about things that could be prefabricated The largest example of that, or the most successful example on the Moose Jaw project, was the exterior wall panels. So instead of stick building those, where the guys would have to work out of lifts, out on the site, up, high up in the air, we had those prefabricated, so they're done in a shop where it's much safer conditions. They came out, they were erected with a crane, set in place. We actually could install the windows when they're down on the ground, instead of having the glazers working out of lifts. So it's those type of things that we can design that into the project, and obviously it makes it, you get a higher quality, but it's also much safer, and it's cost effective.
What this process really allows you to do, and the IPD process allows, is with early involvement from the contractors and early involvement from the trade contractors, you can really collaborate to come up with some really innovative and good ideas. And one that really sticks out in my mind is prefabrication. A lot of times, the way designs are put together and the way buildings are constructed, they don't often allow for a lot of prefabrication, but when everybody's at the table, you've got the owner, you've got the designers of every different discipline, and you've got the general contractors and all the trade contractors, you can all come together and try to determine an innovative solution. And like I said, one of the things that comes to mind is prefabrication. One of the items that we were able to do and would not have been able to do had we not been in a collaborative IPD process is prefabrication of the exterior walls. Through that collaborative process with the engineers right there, working with ourselves and the trade contractors, we were able to somewhat alter the design, or alter the thoughts of what the design was going to be to allow for this prefabrication. And then we had other people coming into these big room discussions where they're just piggybacking off of the idea, and one of the team members brought forward, okay, well, why don't we put the air vapor barrier on these walls in the prefab shop rather than out in the field? And thought, okay, well, that's a great idea. Helps production time, helps safety, all those different things. And then another trade partner jumped on and said, well, if we got to put all these windows and all these panels, why don't we do that on the ground so we don't have to be working up in lifts and then lift them up with the windows in place? So without all of those different team members being co-located together, working together, I don't think we would have got that same solution. But that's just one of the things, or one of the ideas that came about that really tied into the construction.
So what we've heard from the patients and staff and families that participated in the collaborative approach of this project is really that the ministry and the Five Hills Health Region have succeeded in creating a truly patient-centered hospital.
So some of those ideas that we had about reducing steps for patients, we're able to integrate all of those things into the design. And so that came right from our 3P experiences.
So the level of ownership and the commitment that we have within this building, and I'm not saying that we don't have still ongoing pains that we're dealing with, there's a lot of pride in terms of the involvement that was very evident throughout the process. The
design process for the IPD project was much faster than traditional. From the start of our assignment until the time that we put the first shovel in the ground was less than 12 months, and that would never happen on a traditional project. Now, the overall design carried on much longer than that, and it was probably not a lot shorter than traditional, but it certainly was shorter.
In a traditional method, we would not have been able to overlap the design and construction nearly as much as we did. We were able to deliver the entire project from functional program to substantial completion in less than 3.5 years, which, in speaking amongst our team, we talked about some of the results that would be expected in a traditional method, and the discussions that we've had with everybody's experience obviously brought in that this would be a sort of a minimum 5-year process had we went a traditional way.
The IPD process allowed latitude to the designers to explore some design options that you might not get afforded in a traditional process.
They often say that even before you open a new facility, it's already kind of extinct, or there's things that are just not going to work. I believe we've designed and built a facility that will serve this community very well for 50 years and beyond.
Having a look at the results of the program and the areas I specifically worked in, they're almost identical to what we suggested. And I have been a patient in the new hospital since it's opened. Compared to the other hospital, it's night and day. It's so different. The communication levels are so much better.
We had patients in operating rooms 42 months after the team was selected, which is extraordinary. It's some 24 to 30 months quicker than a traditional project. We believe, the team believes, that we delivered the project some 10 to 15% below what market prices would have been at the same time. So there's two compelling reasons right there. We also think that we delivered good value to Five Hills ultimately, and to the people of Moose Jaw and the Five Hills region, and that's the testament to what the project can deliver. I mean, cost and schedule is important, but ultimately bringing value to the community is what you're trying to do.
There were a number of things, but the one thing I think that really stood out for me was hearing from our patient family reps how they really felt that they were included, that they were heard, and that they actually helped to shape the design. That was probably something that will stay with me for a long, long time.
From our experience, we would definitely use integrated project delivery again on a major capital or construction project.
So while the review of the procurement and the hospital build is still underway between Five Hills and the ministry, I can't say that the results speak for themselves, both in terms of the cost and the timeliness of the project. The ministry is pleased, and we would certainly be considering an IPD approach for future projects. Obviously, there are some lessons to be learned, and there is some experience gained through this project that will help us in the future. But overall, I think that this was a valuable experience in going through this process, and I think the end result of this new hospital is fantastic.
Within Graham, I know we would do IPD over and over and over again. We already have. We've done another IPD project since the Moose Jaw Hospital. We're just getting involved in another. So it's definitely something that we want to carry through with.
So as a participant in IPD, I think that Stantec would fully commit to the fact that we are on board with the process, and we'd like to do it again. We have two projects that we're currently looking at as IPD projects.
If anybody is interested in something like this, I would strongly recommend it. It's a great process. Putting it together, having the right people in place, and bringing patients in, you can't go wrong.
I wouldn't trade it. I wouldn't trade it. I just think it was because the other thing that happens as you go through, what do they say? What doesn't kill you makes you stronger. And I think as a team, that very much happened. We just became a stronger team through all of this. What are the things that we would want to guide them on? It would be resourcing it appropriately. And it wasn't that we intentionally didn't resource it, we just didn't know what it would mean, right, in terms of how to resource it appropriately. So it required a lot of work by our managers in terms of gathering data before we went into 3Ps. So understanding that data, understanding our flows in our current state, and then what should the future state look like? What did we want the future state to look like?
So what we've learned from this project is that you need strong leadership, not only from the ministry, not only from the region, but also from the partners. So lots of the decision making on this project, because it was new, because lots of the partners hadn't experienced this procurement model before, senior leadership was involved right from the start, early and often. So I think I would communicate that to any other regions or any other organizations that are considering an IPD, that your senior leadership will be involved heavily in the project. It's really a procurement approach that is very front end heavy. There's a lot of procurement and a lot of time spent up front getting a contract developed, getting the plans done. There's a lot of due diligence right from the start that's really time consuming, time intensive.
You, without a doubt, have to have the senior leadership of the organization committed to making it work.
It's simple, but it's not easy. And what I mean by that is that it takes an awful lot of hard work, probably more so on the ownership part, because they're not allowed to sit back and let everybody else, develop the design and then price it out and then build it. They really have to roll up their sleeves and be part of the team in order to, to make decisions and to allow the process to move forward. From the design firm, again, it's one of those things that it's got to be very collaborative. They have to be open to looking at multiple solutions and not just single point solutions. And from a contractor and subcontractor side of things, you have to be willing to work in a very collaborative environment. You have to be able to look at conceptual estimating, and you have to be very good at production forecasting and production management. Those are key components to the success of an IPD project.
I think absolutely the most important thing is to do a really good job of selecting your team and making sure everyone on the team truly understands what ILPD means and understands all of those concepts about commitments and working together as a team rather than in a conventional model.
Is you can't just dabble. You have to be in it with both feet. You have to be all in, and you have to make sure that at times you're able to take off your company hat and put on that project team hat and work for the betterment of the project. It's always about optimizing the whole and optimizing the project.
For a designer to get involved in an ILPD project, you have to understand that they're going to be much more closely working with their ILPD partners, and they have to take that working relationship much more seriously, because you're so tightly bound by the context of the contract and your working relationship, and you're going to be working shoulder to shoulder with those people through the entire process, not just through a part of the process.
In an IPD project, when you're talking about risk and incentive, it's really the comfort level, and the advice that I would give is trying to make sure that you have that level of comfort of putting that profit and the incentive together as a team and as a group. Is making sure they understand what the risk pool really is and how that operates. And
I'd encourage them to do a lot of learning and talking to people. I'd also encourage them to partner with people that have done it before, because really without that experience, that there's going to be a lot of missteps potentially, and it is the coaching that's offered by a partner with experience is invaluable.
Sort of catch-22 maybe, but with IPD, I think you need to have previous IPD experience somewhere within your team. That's where we brought on two partners that had both delivered several IPD projects in the States, which they were able to guide the rest of our team.
So one of the things that would be a flag for me to avoid as an ILPD project is somebody that's trying to start the process and form their own process under the guise of IPD. Although the IPD process is new to Canada, it's not that new in the United States, and there's been a lot of lessons that they've learned, and their formulation of contracts and the way they go about things in the IPD process has had a chance to evolve.
One of the significant considerations of the partnership was the contract. A significant amount of time and effort and cost went into bringing together all the partners and their legal counsel to make sure that the contract was agreeable amongst all the partners. So I would just advise any other organizations looking to do an IPD to take that into account, that there's a significant amount of due diligence and upfront planning that needs to go forward.
I think that the self-forming aspect of the ILPD is important. Those core assemblage of the team self-form, and they need to be culturally and aligned with one another when they go into the project on a starting basis. And if you're not self-forming, then it's very difficult to say that could happen.
trust. That's huge. You need to have trust with your entire team. You need to be able to trust your owner and trust your designer and trust your trade partners, and that trust needs to be reciprocated. So that's a big one for me.
Maximization of the number of people that participate in the ILPD and as risk pool participants, because I think that really binds people together in a meaningful way. And
when I talk about the level of commitment and the importance of leadership, I don't know how to underscore that in a way that people really understand. This is not what we've been through and what we're continue to advance. This isn't easy work, and it does takes vision, takes courage, and it takes very strong leadership.